This video is to help with the application of Silvadene dressings. This type of dressing should be changed every day. When using Silvadene, you will also need to recream the dressing once each day. For example, if you shower and change the dressing in the morning, you will need to recream in the evening. The items you will need for this type of dressing are your Silvadene cream, gauze or clean cotton fabric such as an old t-shirt or pillowcase cut to the size of the wound, something to hold the dressing on such as burn net, gloves, pantyhose, socks, or other creative dressing. There will be more information provided shortly about these creative dressings. Remove dressings from all burns and wounds carefully. You should pull the dressing back flat against the skin instead of pulling up. This will prevent accidentally removing graft or new skin. If dressings are stuck to the wound, do not pull them off. This will remove any new skin that is growing underneath. Simply use a clean scissors to trim the loose dressings, leaving the stuck part alone. The shower will help loosen the dressing and help it come off. In the pictures shown here, this green drainage is normal. When you shower, use a soapy washcloth to carefully remove the layer of cream still on the wound. Cellulitis is when bacteria infects the wound and the skin around it. Usually, it starts with tenderness, redness, and swelling around the wound. Sometimes a fever will also develop. If redness is noted, we will mark your skin and watch it over time. You may be asked to do this if you notice any redness after you get home. It may be helpful to have the Silvadene already on the gauze or cotton fabric as shown here. Once you have washed your wounds and dried the areas, these will be ready to put into place. Using the gauze or cotton fabric, cover the open areas. It may help to have a small amount of dressing overlap onto your normal skin in case the dressing slips. Hold the bandage in place with an outer dressing with burn net, pantyhose, tank tops, a sock, or another creative dressing. If your dressing gets dirty, they should be changed. This will help prevent infection in your wound, which could delay healing. When using Silvadene, you will also need to recream the dressing once each day. You will need to reapply Silvadene in the evening or 10 to 12 hours after your dressing change each day. For example, if you shower and change the dressing in the morning, you will need to recream in the evening. To do this, remove the outer dressing but leave the gauze or cotton fabric in place. Cover the wound area again with Silvadene cream. Reapply the outer dressing. The following day, you will remove everything and start the process over. Here in the hospital, we use specific types of dressings that are not always easy to find in our home communities. We have lots of helpful hints for how to make your own dressings. These are just as good as the hospital bandages and can even be washed and reused. The key is to have a dressing that will cover and protect your wound and keep it clean and dry. To make gauze, cut pieces of a t-shirt, bed sheets, or a pillowcase to the size needed. We recommend to cut 2 to 3 days worth so you can wash them when not in use. When you are ready for a dressing change, apply a thin layer of Silvadene to the fabric. Once this is done, it is ready to be placed on your clean wounds. Use a creative way to hold the dressing in place until the next dressing change. We recommend pantyhose, gloves, socks, boxer briefs, or a snug-fitting tank top as shown here. If you have questions about our creative dressings, please do not hesitate to ask one of your care providers. If you notice any signs of infection, a change in the color of the wound from pink, red to tan, brown, or black, a change in the skin around the wound, a healed wound that starts to reopen, or you have trouble coping, please call us at 319-356-2496 or toll free at 1-800-777-8442.